Hello everyone, myself Dr. Sahil Patel, a consultant homeopath. So today we are going to discuss about injuries and emergencies chapter from Dr. Borland's book. As we all know, I had discussed about Dr. Borland. He has written many books on children's types, digestive drugs, homeopathy for mothers and infants, then homeopathy in regular practice, then homeopathic therapeutics, then influenzas, pneumonias, some emergency conditions, treatment of certain emergency conditions, and all those books were written by him. So he has very good experience. There are short notes given from his side to homeopathic practitioners which can be observed as a note and which can be help for our daily to daily practice, right? So today is the second session. We are going to discuss about fractures. This is going to be a short video because fracture is not the role or the main primary role of homeopathic physician is not much more in the cases of fractures, but to enhance the healing of the fracture, to enhance the healing of the joint or the bones, there homeopath's role is present. So in the cases of fracture, primary goal of a homeopathic physician should be that person or the patient has definitely to take the treatment from the orthopedic side. Why? Because the dislocation or even if the non-alignment of the bone, if the alignment is not proper, then the person may be having the future problems regarding the disability for such conditions. So our role is that first orthopedic is to be consulted, and after his basic primary treatment we have to start our homeopathic medicine in some of the conditions which I am going to discuss with you from Dr. Borland's book. So we are going to talk about fractures. As an ordinary routine, start the patient with a single remedy, which is Arnica montana, as we have discussed in the last lecture also, that in sprains, dislocations also, Arnica is one of the most basic drug which can be used. In spite of Arnica montana, we had also discussed some other remedies in that video, like Bryonia alba, Rustox, Ruta, Strontium carb, Calcarea carb. So those were the remedies which can be given. In the end, I had also discussed in that Apis mellifica can also be prescribed for the patients. So now in fractures, there is a considerable amount of pain in the patient, effusion of blood and bruising is present where the problem or where the fracture is seen. So the typical aggravation is seen in this patient, which is from movement. So Arnica montana can be given in such cases when dealing with a comminuted fracture where number of the spicules of the bone, particularly in the neighborhood of the joint, where the nerve endings have been injured because of the splinters of the bone are present at that side. So person is having shooting type of neuralgic pains where the nerve is compressed, nerve endings are getting affected because of the fracture or the because of the impact of the fracture. So which remedy can be given? Yes, you also know hypericum can be given in such cases where Arnica the bruise feeling is present, but in hypericum we can definitely blindly prescribe that remedy for the disruption or the injury directly to the nerve endings or the nerve roots. Hypericum can be given. Then when a bony union is slow, where the callus formation is needed to be getting the faster boost up of the calcium metabolism, in such conditions they also, orthopedics also give the medicines which are having supplement actions like calcium phosphates, magnesium phosphates are given. So in such conditions where a person is having a complaints of slow union of those bones, Calcarea phos remedy can be given. Calcarea phos can also be given in 30th potency. You can also definitely, you should prescribe it in the biochemic potency also. Why? Because it will lead to faster metabolism of calcium salts in our body, so that the cellular action which is going on the site where the callus formation is to be done, the calcium deposition can be enhanced because of that. So Calcarea phos is the remedy for that. Another possibility for such condition where the callus formation is having a slower union of the bone is there, then another remedy is Symphytum. You should not prescribe Symphytum in the lower potencies. You can prescribe it in the diluted form. In the 6C potency or the 30th potency, it works very good. So you can go with the biochemic remedy from the Calcarea phos and Symphytum remedy in the 30th potency for those patients. These are often very helpful in many cases that the indication is difficult because of the local injury is there, only pain like symptoms are there, then these remedies can be given. So see, there are very few remedies in the cases of fractures. As we all know, there can be many remedies which will be given in the repertories, different repertories, but the primary goal of the treatment for the fracture patient is from the orthopedic side. Secondary role comes from the homeopathy side for boosting the metabolism of calcium, for boosting the healing processes of different sites of fractures, and third, for boosting and giving the proper palliative management for the pain conditions in the nerve endings where we were talking about hypericum remedy. So this was the second remedy and the second affection of that, where Borland sir has given and the taken the topic of fracture in the cases of emergencies and injuries directly to the patient. So this was our second lecture. In the next lecture, we are going to discuss about head or spinal injury. If you have any kind of queries regarding these videos, or if you want to learn any other therapeutics other than this, then you should definitely contact me, as well as you can note in the comment section that what kind of videos do you want to take. I can discuss about the physical affections, local affections of the patients, as well as the mental affections of the patients. I have made videos on psychological effects of the drugs, their daily to daily psychological affections of the patient, so that in what conditions the person is living, right? So thank you for watching this video, and kindly stay tuned with my channel for more homeopathic content. Thank you.